Hello, good afternoon. This is Michaela Chandra. I'm videotaping my practice health assessment with the help of my husband as my patient. So I'm coming in from the door. I'm going to say, "Hi, this is Michaela. I'm your nurse today." And as I introduce myself, I will go to the sink and wash my hands and get my gloves. Put on my gloves. So can you tell me your name?
Luke Chandra.
Can you tell me where you are?
The hospital.
Do you know what date is today?
Today is Sunday.
So what brought you here, Mr. Chandra?
My annual checkup.
Okay. So as I'm talking to him, I will get my vitals, check his temperature, blood pressure, and as I observe him, I will look at his skin color, his posture, and I will observe his respiration. So it looks like he's not having any trouble, and his saturation level. So, Mr. Chandra, I will check your head. As I'm checking his head, I'll check his hair. Any incision, so there's no incision. I'm checking your forehead, and let me know if it's tender.
No, it's not.
It's good. So now I'm going to check his eyes. And then, can you please look at my pen light?
Okay.
Without turning your head? I'm going to check his ears. Can you say ah? Check his mouth, nose. Checking his sinuses. Can you say ah? Can you bite down for me, please? Can you smile? Can you frown? Can you feel this?
Yes.
Can you hear this?
Yes. Yes.
So now I'm checking his neck. Okay, can you look that side and then against my head? Can you push your neck against my head? Good. Good. So I check his neck, and now I'm checking his shoulder. Can you push against my hand? Good. After the shoulder, I'm going to go to his upper extremities, his nails, that's good. Can you squeeze my 2 fingers, please? That's good. And I'm going to check his radial pulse. That's good. So after my upper extremities, I'm going to listen to his heart. And after listening to his heart, I will check his chest and stomach. I will listen to his stomach. After that, I'm going to go to the back to listen to the lungs. Can you sit? Can you? Thank you. Can you have a deep breath? So after that, I'll check his skin at the back too. And now, so after I check his upper body, we're moving on to his lower extremities. I'll check his skins. I'll check his lower extremities, his nails, skin temperature. Where? Lower extremity pulses. Let me fold it. Okay. So we're done doing the assessment on his lower extremities, and now I will tell him that his animal checkup health assessment was normal. So with my physical health assessment with Mr. Chandra, he was alert and oriented to person, place, time, and situation. All his vitals were normal. His hair was normal, and his skin was warm, dry. He has a perla of 3 mm. His nose were moist, and his mucous membranes in the mouth were pink. His tongue is midline, and he didn't have any lesions and dentition. On his neck, his jugular vein is not distended. His trachea is in midline. Carotid pulse was present. On his chest, his apical pulse was present. It wasn't muffled. His breath sounds, anterior and posterior, were normal. It was clear. His skin turgor was good. He's not dehydrated. For the abdomen, the contour was normal. It wasn't distended. It wasn't hard. It wasn't firm. With the auscultation of his abdomen, all the 4 quadrants were active. When I touched it, it wasn't tender. For his upper extremities, his radial pulses were equal. It wasn't pounding. It wasn't weak. His creep were equal. Capillary refill of less than 3 seconds. For his lower extremities, hair were present. No edema noted. And his nails looked healthy. It wasn't thick and it wasn't yellow. Pedal pulses were present. And I forgot to ask him if he's having any pain.